Hi, everybody. Thanks for joining us. For those of you who don't know me, my name is Peter Llewellyn, and I run the services at MedCommsNetworking.com and the associated websites. So information, resources, activities for people who work in and around medical communications, medical education, medical publishing, and the associated businesses right across the globe. So again, we've got a good international audience in for today's webinar, which we're recording and which will be on NetworkPharma TV later on. If you've not seen over there, there's lots and lots of videos now. There's hundreds of videos, many of them from webinars like this, but a lot of other video content as well. We've also got lots of content for those of you who are interested in the business over at firstmedcommsjob.com and so on. So go and have a look at those resources if you've not seen them already. Okay, so I love these webinars. We get experts from all over the world and talking about all sorts of matters that are important to MedComms. Delighted that we've got guys from the Patient Information Forum today. So thank you everybody for joining us. I'll let you introduce yourselves. Sophie, I'm going to hand over to you to kick us off. We have a presentation and some Q&A. So those of you in the audience, do share your questions in the text box. Sophie, over to you.
Hi, I'm Sophie Randall. I'm the director of the Patient Information Forum. I've worked in MedComms for over 20 years in agency and now at PIF. So quite a broad spectrum of experience with different clients in different sectors.
I'm Dan Wills. I'm the quality manager for the Patient Information Forum, and I've been assessing and supporting charities and other organisations produce good quality information for about 15 years now.
I'm Virginia, and I have been a pharmacist in London for 7 years and then transitioned into medical copywriting for the past 4 years. And I'm a health content creator, and at PIF, I help to engage people to get the PIF tick, which is an accreditation that shows you are a trusted information creator. I will share the presentation.
Okay, brilliant. I can see that now. So we're going to split the presentation between the three of us, so you get to hear from all of us. So as we've just introduced ourselves, what we're going to do today, rather than me introducing the team again, is we're really going to look at the PIF tick scheme we run and how we accredit trusted information creators and how the criteria we have developed for that is helping set standards for evidence-based health information, certainly in the UK, but it's sort of spreading internationally now too. So Virginia, next slide, please. We're going to look at who we are as the Patient Information Forum. What is our PIF tick? What are the benefits of it? And most importantly, what difference is it making? What is the impact of the PIF tick? So next slide, please, Virginia. And so we'll start looking at who we are as an organisation. So the Patient Information Forum is fundamentally a membership body for people working in health information and support. We were established 26 years ago after a King's Fund report was questioning the state of available patient information for people with long-term conditions. And so we started as a very small group of information producers who wanted to sort of share expertise and best practice. We've gone from over that period to become a membership body and a charity. And we now have around 1,600 members, predominantly in the UK, but also internationally. I think what marks out PIF as a mark of difference from other organisations is we are cross-sector. So we have members working in the NHS in the UK, we have health charities, we have multinational companies, we have smaller individuals creating health content, and we have agencies. And it's a really broad church. And the great thing about that broad church is that we are able to share best practices from each sector and really share and network the challenges and the solutions that we need to get to in health information. So one of our key objectives at PIF is to provide expert guidance on the production of high quality health information. And in the chat as we came in, we were talking about AI. And I think this is not something that stays static, this field. It's really developing rapidly at the moment. So we are constantly drawing on our sort of community of practice to sort of set best practice consensus guidelines for some of the new challenges that face us. Fundamentally, we believe that there should be evidence-based and accessible health information for everybody, so they can make informed decisions about their health and care. what we've seen in the past is that good evidence-based information has not always been accessible. And when we asked the public what was important to them about health information, those were the two key things: that it was based on evidence and that actually it was easy to use and understand. Following the kind of development of PIF and the changes in health information and the sort of emergence of misinformation, we have developed a trust mark for health information to help the public find information that they can trust. So next slide, please. So this is our vision, and it's kind of pretty similar to what I'd already said, that everyone has access to personalised health information so that they can make informed decisions about their health, well-being and care. That has been PIF's long-standing vision. It hasn't changed much, certainly in the last 10 years. I think we're realising that we need more personalised health information and that people's health information needs are nuanced. But fundamentally, people need to be able to make informed choices about their health. So next slide, please, Virginia. So we have four kind of pillars in our strategy that support this. The first is quality. We want to have really high quality health information, and our main activity under that is the PIF tick, which Dan is going to describe in more detail. Expertise is the sort of CPD accredited training. It's the best practice guidance. It's our PIF webinar series where we share best practice and we develop the expertise of members. Inclusion is really focused around the accessibility piece and how we can make sure that health information is inclusive as possible. And in the last couple of years, we've put a lot of emphasis on plain language, translation, inclusive language, risk communication that people can understand and use. And then the final piece is integration. It's great to have this health information, but it has to get to people, and it's how it gets to people on their journey through the healthcare system that is really important, because we know that healthcare professionals are really important signposters of health information. So we work on best practice projects within the NHS to kind of improve that integration of information into people's care. So we personally believe that information is kind of a therapy in its own right. So we are supported by our partnership network, and this really does provide a sort of snapshot of the breadth of our membership. So we have some pharmaceutical companies that you'll recognise in there. We have some large agencies. We have governmental bodies in the UK, so sort of NICE, National Institute for Clinical Excellence. And then we have some of the major national charities. So Macmillan are partners, and so are the Self-Care Forum, and so are National Voices, which sort of represents the charitable sector on a policy level. So we're, as I've said, we're our broad church, and the kind of contributions we get from working in partnership with our voluntary sector partners is the sort of focus of our lobbying and integration work. But we work really closely with our partners to embed what we're doing in their work, and that's certainly been the case with the work we've done recently with the ABPI, for example, looking at training their teams, looking at consultations on the update to the code of practice. So next slide, please. So I think it helps sometimes if we look at the challenge that we face in health information. And I think because we're all tend to be quite well educated in health information, it's really easy to forget that literacy and numeracy skills are quite low in the UK. And the landmark data we have on this is quite old now. It's from 2015. It's from Rowlands et al. And they found that 43% of adults didn't have adequate literacy to understand health information. It was as it was currently written. And actually, it was actually 61% when numeracy skills were also needed. And numeracy skills are virtually always needed in health information. Interestingly, Pfizer and the Academic Science Network in the southeast of England did a study which was published about 18 months ago, where they asked a panel of patients to review the patient information leaflet that's included with medicines, and they completely replicated this data. So to most people, or to a high proportion of people, the patient information leaflets that are included with medicines are really inaccessible to a lot of people. And that hasn't really changed. We also know that translation is becoming increasingly vital, and in the UK at least there's up to 1 million people who cannot speak English well or at all, and they are also quite often the people who have the worst health. We also know that tone is really key. So a resource can be easy to understand, but it can be meaningless if the tone is incorrect, and people are very quick to feel judged if they are looking at health information, and the tone is a bit kind of nannyish. So next slide, please. So when we're talking about those figures, it's quite interesting sometimes to think how that actually translates. So here's a few statistics I'm just going to pick out. So 5 million adults can't find relevant data in standard health information in the UK. 1 million find it really hard to follow a letter from a GP surgery. And 6.5 million can't measure or record height and weight on a chart. So I think that sort of shows you the scale of the challenge that we face, because health information, particularly around new treatments, is becoming increasingly complex. So what we know is there are some groups that are more vulnerable to low health literacy, but there's an intersectionality now of multiple disadvantage with low health literacy and other factors that impact on health. And what this means is more health inequalities, more preventable ill health and death, and also general negativity towards health and healthcare, which is really important to bear in mind. So next slide, please. The biggest impacts of low health literacy, according to a survey of our members, are vulnerability to misinformation and disinformation, which is a kind of new and emerging challenge, but also that crucial element of communicating with healthcare professionals, which is it's compounding that issue. If you've got health information you can't understand, and then you struggle to communicate with healthcare professionals, it's really hard to get the information that you need. Next slide, please. So I'm going to pass over to my colleague Dan now, who is going to explain about the PIF-TIC and what it is, and actually how it's helping us and organisations that are part of the scheme to meet this challenge. So over to you, Dan.
Lovely, thank you, Sophie. So what is the PIF-TIC? So the PIF-TIC was a scheme that we launched in 2020. It's an independently assessed quality mark for health information. The scheme came about following the closure of NHS England's information standard. A lot of people liked the fact that there was somebody out there providing a quality mark, doing assessments and supporting them. We run the scheme on a non-profit basis, and it's all around people that create good quality information meeting our 10 criteria, which I will go through in a little bit of detail later, not full detail because we don't have time for that, but I'm more than happy to spend some time with you at some point going through it in a lot of detail. We currently have 162 organisations signed up to follow the PIF-TIC guidelines and go through that assessment process with us. And one of the key things that we wanted to do with the PIF-TIC, as well as helping organisations create the best quality information that they can do, is to raise awareness with members of the general public of what they should be looking for. So we've created a public-facing website which offers guidance on things like BMI, understanding risk, but also just some top tips about what you should be looking for when you're looking at health information. So does it have clear dates on it? Can you get references if you wanted to? Is it in plain language that we can all understand? Are we trying to hide things away? And there we just feel that they're going to guide people into, even if an organisation doesn't have the PIF-TIC yet, where those good qualities are, and try to combat mis and disinformation. Next slide, please, Virginia. So here's a small selection of some of the organisations that have gone all the way through the PIF-TIC accreditation with us, so are fully certified. You can see, again, as Sophie said earlier, we've got quite a mixture of organisations. We've got some agencies that work more with pharma companies. We've got charities in there, both large and small. We've got commercial organisations. We've got pharma companies. We've got regulatory bodies like the ABPI. There's a big mixture of organisations that can go through this, and we manage that by having different parts of the criteria that are more applicable to different parts of the sector. And I'll explain a little bit more around how we section that off as we go through the criteria in a minute. Next slide, please. So one of the other things that we kind of noticed towards the end of last year and early this year was around how people's kind of attitudes to health information and where they go to find it is changing. So as Sophie said earlier, you know, this is not a static field. It moves all the time. When I started in health information sort of 15 years ago, it was very much, here is a massive guidebook on everything that you'd like to know about your condition. Then over a period of time, it became, here are websites that you might like to look at. And now with the growing popularity of social media, a lot of people that are comfortable on YouTube, are looking on TikTok, they will have these relationships with online creators and they will want to go to them for their information. So we've expanded the PIF tick now to include content creators that are creating information in their own right as individuals as well as organizations. Next slide, Virginia. So we don't just have the PIF tick that's kind of, you must come in and do all of these criteria. We actually look a little bit wider around who else are doing really good things with health information, and then we partner up with them so that we don't have different guidelines in different areas. So World Health Organization actually included the PIF tick in one of their case studies on how to combat misinformation. NHS England contacted PIF and said that they would like to look at the criteria that we've got, and they've based a lot of their new content standards on that. Now that's a self-assessed scheme, but it is something that's definitely pushing people in the right direction. The Academy of Medical Royal Colleges also brought Sophie and me in to have a look at the criteria that they were making for their content standards, and they align very clearly again with the PIF tick. And YouTube also got us involved in the work that they were doing for their health shelf, and that uses again some of the key things that we have in the PIF tick, but that's open to non-NHS sources. So that's a slight difference between the health shelf and the NHS England one, although they are very much aligned as well. Next slide, please. So this is the sad, boring elbow patch part that I like to go through and can spend hours talking to you about, but I will try and keep it as brief as possible today. So this is the 10 criteria that we ask all of our certified members to adhere to through an assessment process with us. So the first area that we look at is about having systems in place. So there's no point in trying to create information ad hoc. What we like people to do is to have a consistent approach to producing it. And for an organization, that gives you that stability that it doesn't matter if you have somebody on long-term sick, you have a change of staff, you know the quality of your information is going to be consistent. And again, that's really important to patients. They will just want to know that there's that logo on it, it's come from the right place. The second part is training. There is no point in having a lovely process if the staff don't know how to follow it or don't know where it is. So we make sure that there is a good induction and ongoing training process in there. The third section is around the need. We are really pushing people now to think about why are they creating these resources. If you are dealing in an area in cancer and somebody has already produced that piece of information, why are you creating it? Why is there now going to be confusion for patients around where they should go? Everybody should be creating it for their own audience. Now, there will be some overlap. And what we're trying to do in the background is create hubs where people can share this information and then they can produce it co-productively so that patients are getting the best information all in one place. The next part is quite self-explanatory: evidence. There's no point in creating information if it's not up-to-date, reliable, and from a trustworthy evidence source. So we go into a lot of detail about where is a good evidence source, what experts have you got to check that, how do people understand where you've got your references from, and how do you portray things like risks and benefits of information, because that's an area where we're really understanding that people can struggle. Involving users. So we should never create any health information without users being involved. Gold standard here would be kind of co-production and getting them involved at every point. And we do push our members as much as possible, but we understand budgets and things are in there. And this is one of those areas where we will kind of treat people differently. If you are a very small niche condition, we wouldn't expect you to get the same number of people involved as we would if you were an NHS organization with a larger kind of patient portal to look after. Next slide, please. The next area, which touches on a lot of the things that Sophie said earlier, is around health inequalities. So the information must be written to meet the health and digital literacy needs of your target audience. And we really focus in here around plain language, any accessibility needs that people might have. So contrasting colors, font sizes, the language. We also ask all of our members to be fully aware of the language that they are using to make sure it is inclusive, but also anything that may impact on any cultural appropriateness and things. So it's not just about a straightforward translation. Sometimes that may not help people engage with the information. And again, we look at things like images and stuff like that to try and pull in as many different people as possible. The next section is about content and legal requirements. So information must be really clear, easy to access, but also meet any local legal requirements. So pharma companies promoting things in the UK is not acceptable. So how do you make sure that your information is not promotional? All of those kind of things we cover in here. Again, if we're using patient stories, images, case studies, they've got to have consent for them for a reasonable period of time. The next section is around feedback, and it's very clear that this is feedback, and we want you to store all feedback, not just complaints and issues, but the positive stuff that you get as well. So, you know, if you're active on social media, are people liking your posts? Are people retweeting? Are they commenting on things? All of that is really good. When we look at number 10 about the impact, those kind of feedback things are really useful for there, because we can all look and see, you know, 25,000 people looked at our webpage today, but what did they get from it? One person might make a comment that says, after reading your information, I went to see my GP and I got, you know, prescribed some new drugs, or I went on to see further consultation and I actually was diagnosed with something a lot earlier than had I have not read your information. That is a massive impact for your work. So it's really important that you capture all of that feedback. Disseminating information. We want you to promote your information to maximize its reach. We will help you with doing that. So we have a directory where all of our PIFTIC members are stored. We post out on social media about all of our members. We link them into different areas. So we've worked with 3 very clear databases and organizations that look for health information, and they all take the PIFTIC as kind of part of that. So we've got HCI, we've got TRIP database, and we've got others that will all look at those and say, this is good quality information. So we try to help promote you as well as you promote yourselves, but it's part of that assessment is that you're aware of how you promote your information. And the last one is, how do you measure the impact of your information? So this goes back to the feedback that I was saying around, you know, measuring how many people are using your information, but also what are they thinking about it? And for us, it's about setting clear measures of success so that when you come to review your information in 2-3 years' time, you know what you wanted to achieve with it, and did you or not achieve that? If you did, what sort of level of review would you need to do? If you didn't achieve it, what sort of level of review would you need to do then to try and improve that information? So that was a very quick whistle-stop tour of the 10 criteria. But like I said, more than happy to talk you through it in a lot more detail if you would like. So yeah, next slide, please, Virginia. So that's kind of me done. I'm going to pass over now to Virginia to talk to you about the impact that we've had with the PIFTIC.
Thank you, Dan. So I'm going to go through the impact of the PIFTIC first. So here are a few statistics on what PIFTIC accredited organizations have told us about their experience with the PIFTIC. So 9 in 10 have improved their information production process. So they find it much more streamlined in order to create a piece of health information, whether that's a video, a blog, or leaflet, or any other type of information to communicate health to their audience. And 8 in 10 say PIFTIC has improved or transformed the quality of their information, which is really our goal. We want the health information that is produced to be high quality, and what that means is it's evidence-based, it's easy to access, and it's also regularly reviewed. And 8 in 10 of members use our webinars, training, and guidance to support their expertise. So in addition to the PIFTIC standards and the accreditation, we do also invite members to improve their learning and upskill their team. So we provide training like the Writing Health Information workshop, which is a 3-day workshop, and I am involved in delivering the evidence-based information portion of that. So they're really popular, and if you want to sign up to any of those, do check them out on our website. And we also produce guidance as well. So guidance being the kind of PDF guides, which detail, they're normally around 20 pages or so, specific parts of what you need to do to meet the standards of the PIF-TIC. So for example, if you want to measure impact or you want to write information in an accessible way. 9 in 10 would recommend PIF-TIC to other organizations. And 9 in 11 winners of the BMA Patient Information Awards 2024 were PIF-TIC accredited. And Sophie Randall was a judge on the panel. And it was interesting for us to see that, because it shows that the PIF-TIC standards are producing high quality health information that are having impact in society to help patients make decisions about their health. So here's a nice quote that we got from one of our PIF-TIC members. So they said, "I think the PIF-TIC, is a crucial certification to have in place if you're publishing healthcare information. There is so much white noise on the internet. Our customers welcome arriving somewhere online where they know the information and the process behind its production can be trusted." And so having the PIF-TIC quality mark as a trusted information creator is an easy way for people to identify that your healthcare information meets the quality standards and is breaking through the white noise on the internet and also the mis and disinformation, as Dan mentioned earlier. So now I'll go through some of the benefits of the PIF-TIC. And as the individuals that recently went through the PIF-TIC process, here are a few things that they said. So myself included, before I joined PIF. So there is a quote from me as well as Pharmacist Virginia. So Dr. Asmine said, "With so much misinformation out there, we're coming together as a community and championing high standards for the content that we make." Pharmacist Virginia, who's myself, I said, "It's so helpful to go back and see my creation process documented and see what worked." So in that statement, I'm referring to how when you create a piece of content and it performs really well, it's really helpful to actually go back and see what you did, so then you can repeat that and have the same impact again. Dr. Sophie GP said, "Videos mean I've got appointments available for the people who do need it to relieve pressures on staff and services." So as a GP, she has a lot of pressures, a lot of demands on their services to have face-to-face appointments. So by producing her own health information videos, she can give that information to her patients in a quick way, but also make sure that it's a piece of complete information, so she's not missing anything out, because as you may be aware, sometimes information tends to be repeated a lot. And so it's about being more efficient as well. And Dr. Liz O'Riordan, who is a breast surgeon, she said, "It has helped me make sure I'm using accessible words and language users can easily understand." So these are all great outcomes from helping health content creators to produce a health content creation process. And these are all great pieces of feedback that we received that show that the PIF-TIC is effective in improving the quality of information you produce. So here are some more benefits of joining the PIF-TIC in particular. So you get entry onto the PIF-TIC directory, which is a place where people can go to find trusted information and trusted information creators. So this is an image of the cover of the PIF-TIC member directory, which we released in February of this year. And it lists all of the organizations, charities, agencies, and also individuals. So you're able to go and look at their health information that they produce. And then it's also a point of reference for healthcare professionals such as GPs. So if they do not have the time to create their own health information, they know that the people in the member directory actually produce high quality health information according to the standards, and they will feel more confident sharing that information. Because I think, and I'm sure you'll agree, that when you look for health information online, it's quite difficult to tell if the person who's created it actually meets any kind of standards and you can trust that information. So that's why the directory is really helpful. We also have a public-facing website to promote the PIF-TIC accredited organizations and individuals, and you get access to all of the best practice guidance for producing health information. So that includes things like how to create accessible health information. And you also get exclusive access to member-only webinars and networking events where we invite experts to talk about things like AI or digital health, which we had recently. And you also get discounted CPD accredited training. So as mentioned before, the Writing Health Information workshop, which is really helpful. And also we do health editing and other types of workshops as well. And we also have an Ask the Membership service in the discussion forum. So if you are trying to find out the answer to a question that you have, which may affect your health information production process, then you can ask other members, and we put out an email and they can directly respond to your query. And we also have a PIF Aware weekly newsletter where we keep you updated with the latest information in the health information space. So now I'll pass over to Sophie, who will talk about some PIF-TIC case studies.
Thanks, Virginia. Yeah, next slide. So really, I think, fundamentally, are we making a difference? It's really important that the criteria are changing health information. So I'm just going to quickly talk about a couple of projects. So the first piece there is a piece that was produced by Macmillan in partnership with other organisations that also have the PIF-TIC, so Cancer Research UK, Teenage Cancer Trust and Sarcoma UK. And it was about a really complex new area of treatment. And they really thought hard about how they were going to do this. They thought it was going to be quite a long, complex piece of information, but actually they used co-production and they went through several workshops. And actually what they ended up with was something very short, very concise, that was really focused on the questions people had about this new type of therapy. So I think what we see there is something that's really meeting the needs of those patients, explaining something very complex in a really clear and simple way, but also co-badged and co-produced by 4 charities working in partnership. I think the other thing we've said, and we mentioned earlier, that increasingly health information, people have slightly different needs. So again, this is another piece from Macmillan, who are one of our key members, and it's a guide for LGBTQ plus people with cancer, or whose partners have cancer, or a family member has cancer. And it was, again, co-produced with people. It was produced with particular groups representing those communities. And because it could be a really difficult time for people, particularly when they get a cancer diagnosis, health literacy is situational. It's really hard to absorb information when you've just had a diagnosis. They produced this in an easy read format as well as a longer format. So an easy read format will just give you the absolute key points that you really need to understand about something. And what we find, and what we actually found in COVID as well, is that actually easy read is designed for people who perhaps have more, difficulties, who are more neurodiverse or have difficulties processing information, but actually they're really popular with the general population as well, because they just want to get information quickly that they can understand. So a lot of staff in NHS hospitals were using easy read versions of information in COVID to inform themselves about what was going on, as well as the patients. So next slide, please. This was one of the BMA award winners that Virginia mentioned earlier. This is, again, quite a complex area, sickle cell disease and stem cell transplant. So Anthony Nolan, one of our long-term members, has always specialised in stem cell transplants for mostly cancer conditions, but sickle cell was a completely new disease area with a very different patient population. And again, it went through a process of co-production with community groups to decide what was needed. It identified people's questions. And again, it ended up with very short, concise information that met people's needs. Also, they really featured people from the communities who'd had treatment and had been through the process to share that patient experience, because in some communities there is a distrust of healthcare and pharmaceutical industry for historical reasons, and that's really helped to overcome that by you doing this process of co-production. And this was an award winner in the BMA Patient Information Awards. Now, I was a long list judge on that, so I had to make sure that I wasn't completely partial to PIF-TIC organisations. I didn't just long list PIF-TIC organisations. There are a couple of other really good projects from people who weren't PIF-TIC. But the shortlist panel did select 9 entries from PIF-TIC to win the awards. And what I would say when I was doing the judging, what I really noticed was the accessibility of the information, the extent to which people had involved users, and how people were measuring impact and had evidence for the impact of their information. really stood out from PIV-TIC organisations because they had made that business as usual in what they did, and it was really changing the shape of their information, particularly on the health literacy, friendliness of the content and the reading age. So I think what we're seeing and what's really gratifying for us as an organisation is, yes, people are being able to see the quality mark, they can see the PIV-TIC and know they can trust information, but we also know that the criteria is changing health information to the better and helping us achieve our vision. So I'm just going to hand over to Dan now to finish off.
Yeah, thank you, Sophie. So we have a really kind of clear headline for what does the PIV-TIC do. So does your health information meet the needs of your users? Is it evidence-based? Is it easy to use and understand? Is it based on a genuine need? Do you regularly review it? Has their impact, been measurable? Can you measure that in an easy way? If you can say yes to those things, there is nothing stopping you from getting the PIV-TIC. They are the key areas that we are looking for. So I would strongly urge anybody that creates health information to have a look at the PIV-TIC, think about those areas. If they don't do them, what's stopping you from doing them? And maybe get in contact with somebody to help you do that. And that's something, again, that we could do. But if you're doing all of this good work, let patients know about it. Get that kite mark on there. Get it out so that patients might not know you and the organisations that you work for, but they will know that it's good quality. So I think there's just one last slide with all of our contact details on them. So please, I think we've all said it several times, happy to take questions and answer them today, but also happy for you to follow up with us following this webinar and carry on those conversations. So thank you very much.
Fantastic. Thanks, guys. That was great. Can we lose the slides then? And we'll just have a little bit of a chat for 5 minutes and answer some of the questions that have come in. Can I specifically, though, before we forget about it, and we did talk about this before we started the call, the guidance in terms of using AI, just touch on what you've done in that area. You've produced, I think you're calling it a position statement, but just in your words, tell us what you've done in terms of helping people understand how to use AI in this area.
Well, I'm quite happy to take this one. So we've worked on this with sort of expert panel of members across different sectors. And I think the first point was really to identify how people are using AI, because there are different means of using AI. So I would say one of the most common uses is for translation. So a lot of people are using auto translation on their websites. People are also using chatbots on websites. So that's when they're looking at their own content and surfacing answers from their own content. People are also using it to analyze a lot of free text data, perhaps, that they've had. So you can use guided linguistics tools to kind of do that analysis of free text comments. So you can really get a clear picture of that. But I think that the use that concerns us most is the use of generative AI from open source. And I think you can have generative AI from a source, but even then you get really varied results. So I was part of a panel that did a piece on plain language summaries, and we used 5 different tools and we looked at them, and it produced really different results in terms of reading age, the focus of the content and the tone of voice. But I think when people are perhaps using generative AI to create content, that's where we've got real concerns. So our position statement says you use AI, but have a policy in place which you share with your staff that says how it can be used, and what are the risks and benefits of each individual use, because we're not talking about one lump here. So there are uses which we think are positive, but at the moment we think generative AI for content is not fit for purpose because it doesn't give its sources. It repeats existing prejudices. It's locked out of the copyright protected databases, and it will make up references and have hallucinations. So it's really not fit for purpose at the moment. It's also based on 2021 data, a lot of it, so you'll get really out-of-date information from it. So I think particularly with new people coming in who might be more familiar with using AI in other areas, it's just really important that you have a statement for your organization which says how it can be used, how you're managing the risks, and that you train your staff in that. Obviously these things will develop over time. I think for our charity members as well, they're really concerned about the impact of search in the future, where you'll go to Google and type a question and it will pull in a generative answer from various sources. And that might not credit back to the charities that it's taking the source information from, or any other source. And that has wider implications as well. So I think we'd like to see some controls on AI and sort of copyright protection for small organizations whose content is being used. But the main thing is have a policy, look at the type of usage that you might use, manage the risks, train your staff. Those are our key issues on AI.
Okay, it's interesting listening to what you're saying. I mean, and I don't want to turn this into an AI presentation, but some of what you're referring to there, it sounded to me like you're talking about ChatGPT from sort of 18 months ago. And one of the problems with the AI field is it's moving so quickly and the tools are developing so fast. So,
Absolutely.
you know, what you could do now is on a different planet to what you could do 18 months ago, sort of thing.
Mm.
So the important thing is to think about it, understand it, have your policies, but also
Yeah.
move with the times, I think. Yeah. There was a question, just covering off a question that came in, I think it was from Michael, but just so that everyone knows, I know you answered it, Dan, but basically is the directory, the PIF directory available online? And yes, it is. Basically, if you go to the PIF website, you can quite quickly find that. I wanted just to explore a little bit more, and might be just me being a bit stupid, so forgive me. But what the PIF tick, I know you talk about it as being for organizations that produce their own content. Is that right? And I just wonder where the conflict in there, if any conflict in there comes. For instance, and bearing in mind our audience, MedComms agency, for instance, you know, will be working on behalf of a client and so on. So I just wonder what the thinking is there. Do I, as an agency, go, I'd like to apply for this PIF tick because it gives me more credibility with my client to produce their content, which doesn't seem to be what you're giving me the accreditation for. Do you see what I mean? Or if I'm an individual, as a freelancer or something, can I become PIF ticked and then I'm going to be seen as being an expert? But it's just helping me write content for other people. I just wonder whether you can help me understand where you draw those sorts of lines. Do you understand, Dan?
Yeah, I understand. So with the PIF tick, you have to control the whole process. So with an agency, if you have got the PIF tick, so we do have agencies that go through it, they must control all of the elements of that process. So they must be doing the user testing or involved in that stage, the writing of the information, the sign off of the information, and they kind of pass back to their client the piece of information fully and go, you cannot adjust it. Freelance medical writers do not have that kind of relationship that we see. They will give it back to the organization, and then an organization may go, well, we like it, but we're just going to make these small edits to it and changes. That will then be outside of the PIF tick. So if you produce the information in your own right and control it, you are perfectly acceptable to be in the PIF tick. If you are an agency, as long as you control all of the elements of it, then again, you can be part of the PIF tick. The grey area and the bit that I think you're trying to get to is what happens if you are a freelance medical writer writing for company X, you create something and then company X goes, well, it's kind of nice, but we're just going to make these small edits and amends to it. That cannot be covered by the PIF tick because you have not controlled all of those elements. Now, the agencies that we work with tend to have two streams that they work. So if they work with a pharma company or a charity, they can say to them, we can produce information with the PIF tick logo on it, but that means we do X, Y, and Z. Or we can create information for you with your logo on it, exactly how we did before, and that's not part of the PIF tick. They can't mix things up. They have very distinct, this is the PIF tick channel, this is the non-PIF tick channel. And as long as they control that, that is fine. So with a lot of them, they may well get a pharma company, for example, come to them and go, we want information on X, Y, or Z because we think that's needed. The first thing they do is they go back to that need and go, yeah, a YouTube video on that would be lovely, but actually what you want is a video and you know, a web page or a piece of information around X, Y, and Z that also covers that. They would look at that wider need and make sure that it's there and then go off and get all of the correct information. So hopefully that kind of answers your question.
Okay. I guess. I mean, it sounds fairly clear. I just wonder what happens in real life. And I suppose an obvious question to anybody that's running a tick scheme, whatever you want to call it, accreditation scheme like this: how do you police it? Do you police it?
We do indeed.
Is it possible to police it?
Yes. So we run an annual assessment based on your processes. So when you join the scheme, we look at your process, we make sure it's fit for purpose, we give you some actions, and we do that every year. Once you have been with us for 2 years, we then put you into an information assessment, which is completely random. And what we do is we will come to you and we will ask for samples of your information that have got the PivTick logo on them. We will also do check-in for the PivTick logo to see where it has been used. And where these spring up, at any point, we can come to you and say, you've created this article, this web page, this video with the logo on it. How did you produce it? And we will need to see all of the supporting documents to see that that was created properly. So you get a kind of a grace period at the beginning, which is about your process. Once we've got that process bedded in with you, then we continually check your process is working, but also then take random samples of your work, or any work that we see with the PivTick logo on, we will trace back to who created it in case it's an agency that did it on behalf of a pharma company. So that's how we police the use of the logo.
Okay. So you've been that's fairly clear, I think. And Virginia, let's bring you in as an individual that's been PivTicked, haven't you? You've been ticked, haven't you? Is that the way you express it? I don't know how to, what the right words are there. You've been ticked anyway. So just give us a sense as an individual. So we've clarified the fact that you're basically saying for the content that you produce individually, you have complete control of. You can go, this is being ticked. So Virginia, just talk a little bit about I suppose how onerous it was from your point of view to go through that process and what the benefits to you as an individual are.
I think onerous is a strong word.
Is it? Okay, well then it's okay, so it's not onerous then.
Well, it's not. I think obviously it felt overwhelming because it was something new that I haven't done before. So there's a learning curve. And I, as part of PIF, then I can see how people can feel like it's a lot to do. But if you already have your health information creation process written down, then you've done like 75% of the work. Then you just need to find examples of where you meet all of the different standards and upload them onto the assessment online portal. So it's quite a simple and easy process to go through overall. And once you do it once, it just gets easier every year. And we change and update the PivTick criteria based on the needs of how health information is being produced. So obviously now there's video, now there's AI, so there will be a criteria update soon. And so for me to go through the process, I finished it in a weekend, so about 7 hours or so. I wrote out my content creation process. I found it really helpful to see, that I could create a repeatable process. And I think when you're trying to be efficient with creating health information, you want to make sure that you are ticking off all of the boxes, kind of like your own checklist to make sure, is it accessible? Have I used any words that I haven't explained? Have I included subtitles? Is this the latest evidence there is around, I don't know, the use of this medicine for chickenpox or something? And all of that is really helpful and really useful. And I think sometimes you can get really caught up in putting pressure on yourself to create health information when actually you need to take a step back and think about how you create it before you create it. Otherwise, you're going to waste a lot of time. And also you might end up creating something that is not that great. And so it can be even more hard work to try and go over something that you've already created when actually you might just need to start all over again. And so that's one of the things you want to avoid whenever you're creating any piece of content, not just health content, is you need to have a robust process, and the PivTick actually lays that out for you. And it's not just something that was made up. It's something that's been worked on and agreed upon by lots of different organizations that create health information. So everyone is agreeing that this is one of the best ways, if not the best way, as a standard to create health information. And so if you're doing what everyone else is doing to create high quality health information, then overall the quality of health information across the board should increase, and that will be really helpful for a diverse set of patients.
Okay, that makes sense. And just perhaps again to be clear, it's about the process, isn't it, Dan? It's not. What you're not doing is effectively saying, because it's got a PivTick on, it's 100% accurate. You can't do that, can you?
No, we don't look at every piece of information that gets created, but we control the process that they follow.
Okay. A couple of questions coming in. although I think to some extent you've already covered this, but Anonymous is asking, is it accessible for anyone to be PIF accredited? So long as they meet your 10 criteria, I guess, is the reference point, isn't it? But but in principle, anyone that meets the 10 criteria then is eligible. Is that right?
As long as, yeah, they can meet all of those 10 and they control the whole process, then yeah.
Yeah. Okay. Just out of interest, this is a bit of a random question, but I jotted it down at some point. You talked a lot. Listening to you talking, a lot of you quite often mention plain language. Is it plain language? I just wondered, without wanting to go down a rabbit hole here, how you define plain language. Can you define plain language? What's your criteria for judging if something is or isn't plain language? Can someone take that one?
Take this one.
Virginia? Yeah.
So plain language means that anyone around the age of 8 to 11 years old can understand it. So what we are not saying is do not use the technical term. What we are saying is if you do use the technical term, that you explain it in a way that someone can understand. So that could be using simpler words, or it could be, if that's not possible, using some kind of analogy. And so that's where, storytelling or metaphors might be helpful, but also that what we encourage the most is if you think it's plain language, you should really user test it to check that it is against the person who is actually going to be receiving that information. So as much as we say plain language, we provide all these guidelines, we still would definitely recommend that you get someone to actually read it to give you feedback. So for example, in one of my scripts, I say, monkeypox is infectious or molluscum is infectious or something like that. And the feedback I got was the word infectious makes it sound a lot worse than it is. So what did I actually mean? And what I actually meant was that it can pass from person to person easily. So it's really important about thinking not only about the words that you use, but what it actually would mean to the person receiving it. So it's a nuance as well. So we've said plain language is like a very simple, broad term, but there's a lot that it means when you're actually creating health information.
Okay. And we ought to be wrapping up. So Sophie, can I give you the final words? I mean, just give us a little bit of a sense, apart from anything else, of what, I mean, you've been going 26 years. I don't know, what's happening in the next 5 years or something like that. Just give me a sense of where you're going with patient information forum.
I think what needs to happen in the sort of next 5 years is really increasing the signposting to trusted health information from different sources. I think, that's something we're sort of having discussions with now around sort of digital signposting. So we work with Cognitant Group, who already have information prescriptions embedded into different prescribing systems. But I think increasingly we're going to see the importance of signposting from healthcare professionals, from things like the NHS apps in the different governments, because it's really hard for people to find that information. So I think we'll see more of the same. We'll see a greater emphasis on personalization. We'll see a greater emphasis on writing in plain language, and we will have new guidance coming out on that this week for people to access. And I just think it will be that accessibility that is so important, because if we're looking at health inequalities still, we need to really tackle these health inequalities, and we need to do that through accessible information, but also we need to make sure that the people who need that information are able to find it and are signposted from a trusted source, whether that's a public library, whether that's a healthcare professional, or whether it's by going online and searching for themselves, but seeing credibility marks that will help them find trusted information.
Okay. That makes a lot of sense. Okay, I'm going to draw the line there. We're a little bit over time. So thank you very much for coming online. I'll say that, as I always say, I know I can speak for you. Anybody who wants to contact you, following up using the contact details or LinkedIn or the website and so on. The point of these webinars is to encourage you all to talk to each other. So I hope people will follow that up. And I think there's lots of useful guidance in there. And I think we would all agree, the principles are absolutely something we should all be aiming for. So and to have some guidance and some guidelines and some reference points and education and so on is just really, really important. So good on you for the work you're doing. Thank you very much. I'm going to say thank you very much to the audience. We've got a couple of minutes left, so don't all rush away, but for those of you on the panel, thank you very much. Let's just say goodbye. Take care, everybody. Bye.